Hello, my name is Mark Wakefield. I would like to take the next couple of minutes to review three different ways of approaching fiscal management in healthcare. In this brief presentation, we will look at three areas. First, we will look at the three views that will affect how a leader manages their finances. Second, we will look at the benefits and drawback to each view. And third, we will look at a viewpoint in action. It has been stated that financial management is a discipline with a long and respected history. Healthcare is a business, and the concept of financial management assists in balancing the inflows and outflows that are a part of the business. Healthcare financial management is challenging because healthcare providers are forced to balance financial challenges with patient outcomes. However, how a leader approaches finances in healthcare will be influenced by their personal view that they hold. One view a manager may have is the financial view. These managers generally work with finances on a daily basis. The reporting function is part of their responsibility, and they usually perform much of the strategic planning for the organization. Another view a manager may have is the process view. These managers generally work with the system of an organization. They may be responsible for gathering data, and they are often associated with the information systems in the organization. A third view a manager may have is in the clinical view. These managers are generally responsible for service delivery involving patient care. They have direct interaction with the patients and are responsible for clinical outcomes in the organization. No view is more important than the other, and if leaders are to succeed, they must be willing to work together across viewpoints in order for the organization to thrive. As you can see from the icon in the bottom corner of our slides, all of the three viewpoints do overlap. Leaders must, out of necessity, interact with one another. Even though each one of these three viewpoints may seem straightforward, there are benefits and drawbacks to each one. Consider the financial view. Since financial accounting is generally for outside or third-party use, one advantage these leaders have is the ability to share with the stockholders or beneficiaries the success the organization is achieving. On the flip side, the individuals responsible for the reporting must also share the bad news with the same group of individuals when the financial goals are not met. The process view. One benefit of working in this area of financial management is that these leaders, based on data collection and analytics, have an ability to forecast and adjust financial budgets as required in the moment to help drive the organization's success. The drawback is that a miscalculation of the acquired data can unexpectedly set an organization financially back. This could lead to drastic measures such as staff reduction to recoup losses and stay on financial target. The third view is the clinical view. The benefit these leaders have is that they are on the front lines of patient care and can see the immediate effect of the financial decisions that are made, especially when dealing with supplies required for patient care. For example, a cost reduction strategy for a cheaper set of IV tubing may not be the best strategy if the tubing sets have to be changed out more often. These leaders provide the necessary feedback on the observations and care. The drawback is that they may not be, or they will actually be the last one to know of some of the financial decisions made, and therefore have to adapt and adjust their care strategies in order to make the financial goals work. Let's take a moment to look at a viewpoint in action. One example I have seen revolves around the process view and involves staff reductions in service lines that have not been able to meet the forecasted budgets. This happened due to a couple of factors. One, the doctors for a service line decided to leave our nonprofit for hospital for a better offer from another hospital in the region that was for profit. This resulted in a loss of patient flow and associated revenue. Another factor that fed into the scenario was a reduction of insurance reimbursements. The major shift in payer mix had unexpected consequences after the fiscal year budgets had already been established.